So I was requested by the Men in Black, so I probably should start. What? Hello, everybody. Welcome back. How
Hello.
are you? How are you doing, Zach?
Bad.
Why? Why are you doing bad?
My 40-hour rotation is basically 60, 70 hours now, so
Oh, jeez, Louise. That sounds rough. Tell us more about your topic of the day based on rotations. You're going to talk about rotations today, or what are we talking about today?
yeah, we're talking about how to present your patient to your attending or precept, depending if you're
Ooh,
med
I
school
have.
or pharmacy.
Ooh, let's get into it.
Yeah, so why is this important? It keeps your team up to date on what's happening with the patient in a timely manner. So there's a format you're supposed to follow. The teams listen to certain parts of that format to know if they should jump in and add stuff to it or if they need to intervene in the patient. Sounds pretty important, right?
Yeah. Do you have a time limit?
Uh, the presentations I saw yesterday were 40 minutes long, so I guess not. It was painful.
Oh my goodness.
We had 15 patients doing rounds, and it took 40 minutes per patient. I wanted to die. It was
Yeah,
bad.
it's kind of like you want to put it on 2 speed, 2x speed.
It was the attending's first day, so the presentations are a little longer, which you'll see in medical school that could be happen when they switch attendings around. New attending's on the floor. She knows nothing about the patients. Now she has to get more information than she actually needs. So, anyways, so step one is to know your patient well.
How
So,
well, Zach?
well, you should read all the notes, including all those boring nursing notes that say, "Patient slept all night."
Oh, now you're bashing the nurses, huh? Hey, listen. Sometimes we're just a little frustrated, so some of the notes might come out as weird, but we mean well, all right?
At least unlike the where I'm at right now, the nurse note says, "Patient slept well." Okay. Patient did not pull IV line out last
Okay,
night.
okay. Whoever nurse, whichever was the nurse, it was probably a third shift, so she was probably tired. Well, what else do you expect?
That's all they read, bro. I read them every single day. Patient was bad. We gave lorazepam.
Oh, whew.
So yeah, the just read all the notes. You need to figure out what's happening overnight. So if something happened, like the patient pulled his IV line out, well, you might have to put that back in, or try to get a PIC line out somehow, or you're trying to take out his catheter, which happens.
Oh,
So,
yeah, I've had patients take out their own catheters. That's not fun.
and now you're the doc, and now you have to put that back in. Have fun. But you need to look at all abnormal labs. So if the white blood cells were elevated, well,
Yeah, that's
you should
important.
probably mention that, that's an infection. If there's a CRP, if there is high blood pressure, high heart rate. So when you examine the patient in the morning, how are they feeling? Were they sick? Were they happy? Was their skin falling off? Was there necrosis? Like stuff you need to pay attention to.
You
How
definitely want to pay attention to necrosis.
That's what I've been seeing all the time in the hospital. So like diabetic foot infections. How are
Yes,
their feet?
for anybody listening, necrosis is tissue death. So you're it's just eating itself.
Yeah, it's black. It looks ugly, and most of
Yeah,
the time it requires
amputation.
amputation. You need to go to hospital. Go to the operating room first. They'll try to clean it without amputating it. If that fails, you have to amputate your foot or your leg.
It usually fails. From all the cases that I've seen, necrosis usually it's ends up because they don't really catch it on time. It's usually they catch it like right after, so it's like really bad.
I've been seeing it getting caught pretty well. So I'm on like
Really?
following like three patients right now where their intervention and debridement things went well, and so they didn't
Oh,
need amputation.
whew.
So went pretty well for them. But also, you know the current issues and what possible future issues could occur based on what you found out in the notes. So this process right here, for my standpoint, takes about an hour because I don't do exams on patients, so I don't really care about doing exams. But if you do an exam, you're probably in the patient's room at 4 a.m. Or
Wait, you have to do exams?
I don't like on patients, so I said that part doesn't apply to me.
Okay.
But if you're like a med student, you'll probably be in the hospital at 4 a.m. on internal medicine
Oh, that's gonna be
doing an
fun,
exam
Zach.
on a patient.
Are you looking forward to doing that, Zach?
Yeah, I'm
'Cause
awake at 4 a.m.
I'm definitely not looking forward to that.
So this is kind of based on my experience on rotations, seeing what med students have to do and what I have to do, and also what attending say to me about how I present my patients to them. So the format, you kind of want a one-liner. We'll get into a subjective, objective section, assessment, and a plan.
Soap.
Soap note. So your one-liner, name of the patient, their age, their gender. CC was his chief complaint. So that's kind of what brought him into the hospital. So an example is patient's chief complaint is suicidal ideation. So think about suicide. Brief background of patient on disease state. So patient came out with suicidal ideation, has a history of bipolar disorder, schizophrenic disorder, and has thyroid disorder, while also is on chemo. And then you can go into more detail about patient background if needed. If it's attending's first day or the first day you're talking about the patient, you might need to go into like their surgical history if important, or if they've been in the hospital recently within the last 90 days, since that brings up ideas of okay, they might have at risk for MRSA or Pseudomonas, the antibiotics within 90 days. So, so subjective. So, how's the patient feeling, right?
Hmm.
Is the patient blinking their eyes? Are they awake? Are they able to talk to you? It's really important stuff. I've seen 3 patients recently that are went from talking and doing stuff, now they're in like a coma within like a day.
Oh,
So like the soap note went from being really happy, and then it's like nope, bad.
yeah.
Is the patient eating food? So that's always important. If they're not eating food, you might need to get a NG tube in, stuff like that. Is the patient complaining about pain? Are they complaining about their bed not being comfortable? Are they complaining about anything else? That's important as well. If you're having a patient stay in the hospital for 4 to 6 weeks for antibiotics, you kind of want to make sure you get their complaints under control, or staff's gonna have a hard time with that patient, and the nursing is not gonna be happy.
They're definitely not gonna be happy if we mess up.
Yeah, so and any overnight complaints, this is really important when you're doing rounds in the morning. If there's a complaint overnight that wasn't taken care of, you need to make sure that gets taken care of while on rounds that day. If not, you're not doing your job. So objective, so abnormal labs, and you have to have a reason why you think it's abnormal. We can't say white blood cells are elevated. Okay, why do you think that? Is it because you think they have an infection? Is it because there's inflammation somewhere in the body that might be an infection, might not be an infection? Or abnormal vitals, so heart rate's elevated. What do you think about that? Well, if they're in pain, that can make the heart rate elevated. Same as blood
Right.
pressure. So you kind of need to have a reason what you're thinking, why. And if you can't find a why, that's probably an issue in your learning or something you haven't learned yet and you need to learn on rounds that day. And my favorite part of this, which I mostly care about, is medications. So it's dose and frequency. Even as a med student, you need to know why they're on them. Because if a patient's on a medication, like for example, their home medication dose of gabapentin is 600 milligrams 3 times a day. They're in the hospital receiving 300 milligrams twice a day. Uh,
Uh,
why is that happening? And you need to figure that out why that's happening and what you can do to fix it, which is what happened in a patient recently I was on. That was like the issue I brought up on rounds. And knowing why the patient's on the medications is important too, because if you can't figure out why the patient's on the medication, do we need to be giving that medication to him? Like, I don't know about you, Mitchell, but if I don't need a medication and I don't want to take it,
right. That's
it's
very
like
important.
I don't need my blood pressure medicine anymore. Why am I taking it? Like, I don't need to put extra chemicals in my body because why not, right? Fun.
Yeah. And this is, yeah, this is one of the reasons why I decided to drop nursing and go into medical school.
What
Because
was the
you
reason?
have you have more of a saying as a farm or as a medical student, uh, as an attending or as a doctor on medications and dosage. dosages.
And for those people who are med students out here thinking your attendant doesn't care what you have to say, I've been on rounds now for about a couple weeks now, and the attendings do care. They actually take the med students' assessment of the patient pretty seriously, at least the ones I've been working with. They actually have implemented their recommendations. Even though med students don't really know too much yet, but if they work with the patient well enough, they kind of have a general idea what to do, and the attending will listen. They aren't zoning out when you talk to them. That's a big issue I hear. So the next part of the presentation is assessment. This is like the big thing. So this is talking about the abnormalities you found in your other section, your objective, and just bring them out to like, okay, the white blood cells are high, and we should do this to fix that. Or we should order this, this, and this as a test. This is why assessment and plan are usually combined to one. So you have an assessment, which is white blood cells are high. We should get blood cultures and start empiric ceftriaxone therapy. So we'll go to the plan slide real quick. So how will we fix these? So that's really it for this presentation. So you do subjective. So one liner, introduce to the patient, name, gender, true complaint, brief background. Labs, medications are on for objective. Assessment, figure out what's like wrong with them. So is anything elevated? It's not supposed to be elevated, which your program you use for your medical records should be telling you these things anyways. Are potassium too high? Is sodium too high? Is calcium too high? Is there a elevated or extended QTC interval, which could mean heart attack or acute heart failure? Not heart failure, but heart attack, etc. Or torsades. So you really need to figure what's going on, and then you have to have a plan to fix it. Because you don't have a plan, you talking all this information to your attending is going to mean nothing if you don't have a solid plan with evidence backup. So you should be referencing guidelines, primary literature, studies, really good studies as your recommendations. So, what questions do you have, Mitchell? Any?
A lot, but we can do that off camera because we're getting to the max time.
Yeah, we are. So, if you guys have any questions, just let us know and we'll touch on those in another video. Peace.